Hello, this is Bridget, Blackbird House. We are about to start our live programming. I have some crazy filter on. I am very good at this, as you can tell. Anyway, I'm going to turn you over to our esteemed member. 1 second. Hold on. There we go. NanaEfua, are you on? Okay, we're waiting for NanaEfua. She's connecting. Hello.
Hello.
Hi.
Good day.
Hello. So happy to have you here.
Likewise. Lovely to see you.
Yeah. So I'm going to add, if you want to start, I'm going to add right now.
Awesome. Wonderful. Hello, everyone out there. Hope all is well and everyone is at home loving on each other and the opportunity to relax a bit and take some deep breaths. Thanks so much, Bridget, for putting this together and giving us the opportunity to inform and dispel any myths. And that's what we're really here for.
Thank you.
I don't know if we're able to get
Yeah.
Okay.
Yeah, I'm working on that. So if you want to, there's some people who might start asking questions. You're welcome to do that if you want to talk a little bit about perspective until we get him on.
Yeah, no problem. I wanted to kind of start with just some 3 main bullet points for everybody. We think about what do you really need to know about COVID-19? How do you get, from the space of trying to feel restless and wanting to engage and want to help? And then where do we go from here? Because like all things, this too shall pass. And we want to be able to understand what the landscape is for the future. So most of you guys will probably be inundated in your emails with all this information about COVID-19. The very basic level you need to understand is COVID-19 is a virus. It's a very common virus. COVID-19 specifically is 7 out of the coronavirus family. Most commonly were the most fatal ones were SARS and MERS, and we're back a couple of years ago. But this is not the most fatal version. Actually, the virus itself is pretty weak. The difference is we are learning more and more in the science community about how quickly it's spreading and the fact that it jumped initially from mammal to human and then from human to human transmission. So that is number one. It's a virus. It's a virus that we are familiar with, but we are now beginning to study its trends and its virulence. That means just like when your YouTube show goes viral, it's the same thing, trying to figure out how it moves around quickly in someone's body. In the next couple of weeks, what you will see is more increased numbers. And we say incidents or as we surveil, as we test, we'll get more numbers. It doesn't necessarily mean that this virus is getting more intense and is hurting and killing people. It just means we're getting more data, and data is always good for us to understand how to manage things. And then what are the symptoms, right? So the key symptoms are fever, cough, shortness of breath. It's not runny nose. It's not nausea or vomiting. They can come with those symptoms, but we also have to remember that we are in the the flu seasons, the virus season. So you can have these symptoms and not have anything to do with COVID-19, but everything to do with just having viral type symptoms. The third thing is, who is it affecting the most? It's particularly affecting people who are already immune compromised. And that means if you're older than 65, if you have congestive heart failure, if you have lung disease, if you have asthma, which is very common in African American communities and other communities of color, that's the big thing that we're trying to drive in terms of our asthmatic patients. How do you handle the situation? And then the most important thing is, do you have the immune system to get through the virus if you get it? The third thing that I probably want to make sure we touch upon is, how do you prevent yourself from getting it? So we came up with a nifty thing called the COVID kiss. Of course, we don't want anyone kissing each other. But the COVID kiss is just keeps everything in context, right? Because it really is the fear and the anxiety around, do you get it? What do I do? How do I prevent it? The number one thing is to keep calm, wash your hands. Wash your hands, avoid touching your face, and use regular soap and water as best as you can. The I is if you're feeling sick, keep a distance. Distance doesn't mean self-isolate, because that's very important, because there are ramifications from isolation, because you don't get the information you need and other people cannot see how well you're doing. So we want you to distance yourself, but we don't want you to isolate yourself. The other S is to show compassion and kindness, because, again, we are going to rely on each other as neighbors to check in on each other. I have to say, being an ER doctor, being on the front lines, I see patients every single day, and I have to have a very objective mindset as I'm evaluating and treating the patients. But I absolutely love my nurses, because they show me so much kindness and compassion while I'm working, and little things go a long way. I have a nurse who has a family member who is asthmatic, and long time ago she realized that she had to take care of her son, and she started working on shea butter to build up on her with her son's skin as he was feeling all this asthma. And then recently she made this beautiful thing, says doctor, and it's just a little bling in my life. And I thought it was so cute, because it just made me feel a little special while I was draped in the garb of protecting myself and our patients. So that was shouts out to Katrina and Simply with Shay, because she's an awesome nurse. But that's what I mean by kindness, showing little things that make people feel like you're actually cared about. And then the last S in the KISS is share facts, not fiction. The more facts that you show from the CDC, from the WHO, the more people who are not connected get information. There is a terrible email out there right now that's talking about, if you hold your breath you can't hold your breath for more than 5 seconds, you have it. Or you have self-diagnosing fibrosis. And it's completely impossible to do that at home. So I want to dispel that myth right off the bat. So again, KISS, keep calm, wash your hands. If you're sick, self-distance, show compassion and kindness. And the last S is share facts, not fiction. So without me staying on the soapbox, I'd love to get some questions or anything from the audience.
That's really helpful. Does anyone have questions? We're kind of scrolling the comments and would love to have a question. We are trying to get Dr. Watson on, and I don't know. I know we can get a third person, but I'm having a little problem inviting him. I don't know if you can from your end, NanaEfua. If you can, let's do that. If not, then I'm going to see if how we do this. So, but until then, anyone have some questions? And also, before we go into questions, can you maybe just talk a little bit about your background. We'd love to hear a little bit about that, which is why we're excited to have you on here. You actually have a lot of experience in communicable diseases like this.
Yeah, so I am an emergency medicine trained physician. I also have a degree in global public health and disaster relief. I have done overseas work in both Rwanda and Haiti, as well as done some HIV research in South Africa. And most recent, nationally, I was part of the Hurricane Katrina relief, as well as Hurricane Sandy. And I have been part of the disaster management team, national disaster deployment as a clinical officer. So I've seen things on the front lines, and I can say what resonates with me the most, no matter where I am, is how the community comes together to take care of each other. And much more than any of my experiences within the hospital, it's what I see outside the hospitals and between human beings that really are breathtaking and get us through these really trying times.
That's very helpful. Thank you. Okay, so does anyone have specific questions? I think one thing that you talked about, which is really like what we can do right now, and maybe, I see a question from FilmCon. What recommendations do you have for strengthening immune systems to avoid virus? And if suspected, one may have a virus. Thank you for that question, FilmCon.
Right. Yes. So what can you do to strengthen your immune system? It's that what did your doctor tell you long before COVID-19? The number one thing you can do is drink water, hydrate. And the reason why is just physiologically how the virus works. Most viruses are broken down through our kidneys and our renal system. And so the more you're urinating, the more the virus particles are coming out of your body. So at the very, very minimum, do that. Number two, I would say stay active. You know, we are asked to self distance in your homes. A lot of us now have children in our homes because they're stuck. They're not in school anymore. Have dance-a-thons, exercise, do push-ups, get out the house around the block. If you have a backyard, get out to the backyard. The air actually is a really, really important thing for you. And movement and catecholamine movements when you ramp up your heart is actually good for your health as well. And then all the other immune supports, vitamins, nutrients from as much food that you can still get that's not empty in the grocery stores, but vitamin C, zinc, magnesium, all of these are important vitamins because they're basic building blocks for your cells. And as your cells are dividing and growing, you're also getting better. But I think it's the basics. It's the water, the nutrients, and the movement. All three things.
Got it.
Yeah.
Thank you. Any other questions out there?
One thing I will add to that, one thing I forgot, just to explain again, there's been a lot of concern about, do I need to wear a mask? Do I need to use the N95 mask? Understanding how the virus spreads is important. It's a droplet, not airborne. So it's not TB. It's not, it's not anthrax. You open a container, envelope, and there you got it. It's not that. It's a droplet. That means that it passes through liquid. The difference is what we're as health professionals trying to do is prevent it from aerosolizing. And that just means put it in a position where it can then be up in the air. But even if you're in a room and the person in the room has COVID-19, and they are greater than 6 feet away from you, the chances that they are going to pass it to you is very slim, even without a mask. The issue that we have with lack of resources is important because in public health crisis, we never want to use up all of our resources in the beginning of the fight. We really want to spread it out. And that goes back to why the self-containment is important and trying to what we call flatten the curve, as we've been talking, if you've been hearing the news, so that we can have time to catch up and our resource pool to catch up. So if you have masks, if you don't have masks, you can retrofit mask at home if you really need to. But if you don't have symptoms, you do not need a mask. So if you don't have a fever, you don't have a cough, you don't need a mask. You just continue to do proper hygiene, which is hand washing anyways.
Got it. That's really helpful. And I think I just saw something that came from the CDC talking about that test that they were doing. They're trying to model it. Can you speak a little to that? Because it was pretty disconcerting. And I've been trying to stay pretty calm through this, but hearing that it can last in the air when they aerosolize it. What is that?
So I want to make sure I get clear. Are you talking about transmission once it's aerosolized or the actual testing?
No, they did like once it's in air, like say someone sneezes out into the air, how long it can go, and then how does it float in the air? Does it go to the ground? Like, what is that?
Well, the virus itself, we're expecting that it spreads, it doubles every 6 days, but how long that it actually lasts once it's in the air is still inconclusive. There are studies that say that, it actually doesn't last more than 12 hours in the air. But if there's new data that came out this morning about those changes, I'm not aware of that. I know for a fact that we're not seeing it where, for example, people are worried that if I purchase something from China and it comes, by the time I get the box and it's on the box, can I have it? That's absolutely a myth. It's a debunked myth. How long does it actually stay in a room depends also on the ventilation of the room and how much of the viral particles are they're actually exposed. So there's a lot of factors that will go in the lifespan of the virus. But again, one of the most amazing things that we've learned from the tragedy of the HIV virus is how viruses work. So when HIV and AIDS came rampant, our research and understanding of how virus particles work shot up. The learning curve was quick, and we've been able to, in the science community, build on that knowledge to understand how other viruses work and transform, so we can build treatment therapy and vaccinations to match that. The beautiful thing about COVID-19, it is nowhere near the HIV virus. It's like Muhammad Ali versus, the kid down the block. It is not. Your immune system, if you are healthy, will conquer COVID-19. We're just learning about how frequently it presents itself.
Okay, thank you. I see a couple questions. We'll start with Rana Kirkland. The question is, how do we discern between a really bad flu, this and this? Because tens of thousands of people die every year in the U.S. from flu, and China doesn't seem to be on that trajectory.
I'll
I don't know if you see
the first part of the question.
Yeah,
I'm not seeing it, but how do we distinguish this from flu? We really can't. From symptoms, you can. Many people, the flu is definitely as the question states, flu is has a greater mortality rate in the U.S. specifically than coronavirus has been seen worldwide. Okay, there has been 22,000 deaths from the flu already. And we have a flu vaccine, but yet we don't have 100% compliance when it comes to taking the vaccine. Coronavirus is not a deadlier virus than the flu. So you can't tell the difference. That's why, and this also explains why testing has to be done and in a measured way. Because once you have it, whether you have the virus or the flu, we're going to tell you the same thing. We're going to tell you to wash your hands, stay hydrated, nutrient up, and stay away from really sick people. The reason why is not because of the virus itself. It's about what the virus does to your immune system, causing you to contract other illnesses. So someone with pulmonary reactive airway, where they are congested all the time because of particles reactions. They may contract this, and now their airways a little more compromised than their baseline, and that's what we're seeing with asthmatics and having a greater increase of asthma attacks. But to answer your question specifically, there is no difference between symptoms that you're going to see as a layperson between the flu and coronavirus.
Okay, and I think that's probably adds to anxiety.
Yeah. And again, you and I, Bridget, we're talking about how do we address and quell anxiety. There's two parts of anxiety. There's the fear and there's the hope, right?
Right.
So the fear is this impending doom that something will happen and I have no control of it. Mm-hmm. And the hope is something will happen, but maybe if I have the right tools and maybe if I can figure this out, I can gain control. And so what we're doing with this, being out here to talk to everyone and also with Shared Harvest is to try and dispel all the things that are anxious, that are causing people anxiety and help them hold on to the things that can cause them to be more hopeful. So knowing the facts that even if you contract it, the likelihood that you will die from it is very, very low. Even if you contract it, the likelihood that you would have it for the rest of your life is very low. But again, it's not to just tell somebody to get over it and stop being anxious. It's to walk each other through what element of it is causing you to be anxious.
I think that's helpful.
Yeah.
And what we're going to do in about 2 minutes is I'm going to sign off and have you sign on and invite Dr. Watson, because it seems my lack of Instagram live knowledge is now I'm learning that you can only have 2 and I don't really need to be on here and you don't really need to look out of my window. But I thought it was nicer than my woe down face. So I'm not going to subject you to that. You look so calm. So we're going to do that in 2 minutes. I'm just having Steph send you
You're representing what everyone should look like right now. Calm, chill, at home.
Well, yes, we're trying to flatten that curve.
Exactly. So it is a good example.
Yeah, thank you. So once she gets those, we'll turn this over to the two of you. We do have, in the meantime, we have a question from Meme Kelly Writes Things. And the question is, any particular over-the-counter meds if you suspect exposure? Thank you for your question.
Yes, great question. The answer would be no. There are, just like the flu season, we say the common cold, people are really quick to grab, cough suppressants, a cold, calm, all these things on the counter. And the virus is a virus that will be killed by your own immune system. And so whatever you can do to ramp up your immune system is the best way. And most importantly, hydrate. Whatever you can do to cause yourself to urinate more is the best way. But in terms of whether it's antibiotics you need, no, not at all. It's not a bacteria, it's a virus. And so I would say no to that.
That's a really important distinction too. And I think that we sometimes, even with viruses, still take things. And maybe that's why we're concerned. And I understand the concern too.
I'm sorry, I will say with the caveat, if you have a fever, you definitely want to take Tylenol or ibuprofen to bring your fever down and do all the other things that are supported naturopathic to keep your fever down as well. But also hydration helps when you have a fever, because something that we don't take into account with our fevers are an insensible fluid loss. So your body and your cells are becoming more and more dehydrated when you have a fever. So it goes right back to the basic steps. Drink lots of fluids.
That's super helpful. And then there's a question from Mutual Carbonation. And it's, how can we safely test people when we are behind on acquiring and disseminating tests? Thank you for your question.
Great question. So there's 2 parts to that question. The part 1 is, why are we testing? And two, can we test safely? So the first part, why are we testing? We are testing for surveillance and understanding. We are not testing to treat. We want to know in our country how quickly and how much the prevalence of this virus is. And that's why we anticipate that we will see numbers enlarge. And the idea of the testing is so we can prepare for the future. Can we test safely? Very important. If we don't, if everyone today opens up a block party and starts testing for a block party, we're not able to control for the type of test there is. And we all know, just like everything else, testing is not 100% foolproof. When the first test came out, it only had a 50% false. If it had 50% false positive, that just means for every person who took the test, only 50% really had the virus, right? So that's really bad odds. As we begin to learn and build the science and the technology around it, that the reliability of that test becomes better. That becomes better. And one thing that's really, really important for us to know, and this is what should also ease your mind about testing, is testing has to go hand in hand with symptoms. So I say this is a really great example. If you've never had sex before and you came to my hospital and asked me to test you for if you were pregnant, I would say there's no reason for me to test you because you've never had sex. However, if I test you and your test was positive for a pregnancy, would you believe you're pregnant? That's I guess the best way I can show is like an example, quick example of why, if you don't have a fever or a cough or the key symptoms, the shortness of breath that we know that is associated with this virus, testing you that can increase or decrease the reliability of that test. So you have no symptoms and I test you and you're positive. That doesn't tell me 100% whether the test was important or not. One of the questions that have been going around, I think somebody picked up, was people who have no symptoms could have the virus and pass it on to other people. That is true, but we do that all the time anyway. We're doing that with the flu because of our immune system. So that doesn't, again, change our outcome, or it doesn't change our treatment plan that we have for other people. If that makes sense.
Appreciate it. Okay, so we're going to have one more question, and then I don't know if you saw the login, Nana, information.
I did not.
Okay, check your email, but until then, I'm going to ask this last question, and then we're going to sign over to your esteemed colleague, Dr. Richard Watson, so that we can get a professional and not just my lamp. And I'm going to show you that's my messy side table. I'm not cleaning clearly as I thought I was going to be. But lots of this is from Miss Vanessa Paul. Lots of articles are saying to not take anti-inflammation drugs like Tylenol and ibuprofen. They've been shown to make things worse. They're suggesting taking something else. What else lowers fever? Thank you, Vanessa, for your question. And she also added, they suggest taking a drug called paracetamol instead.
Exactly.
This can be, now this can be to promote paracetamol, who knows?
Exactly.
But what do you think about this?
Ding, 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 ding.
And your follow-up.
Thank you so much.
Okay.
Thank you so much, because this is a perfect example. So paracetamol is a acetaminophen variant, just like Tylenol, but they're two name brands. Paracetamol is more common internationally. In fact, when I worked in Rwanda, that's all we were given. When I worked in Ghana, that's all they have. They don't have regular Tylenol, but it's the same generic medication. So when someone says, don't take Tylenol, take paracetamol, that's don't wear Nikes, wear Adidas. That's what is happening. And I love those kind of questions, because that is exactly the kind of debunking we need to have in our communities. And so when you see things like that, you want to look at the bottom and find out if there's a sponsor there. You can shout it out to the CDC, and maybe, Richard, I can give the plug right now to what we're doing. So Shared Harvest Fund is my nonprofit organization, one of my nonprofit organizations, and what we're doing is launching a platform for free telehealth, and Dr. Richard Watson will talk a little more about it. But what we're trying to do is offer free telehealth services for communities that don't have access to a medical home. One of the things that we notice working in the emergency department, it is the safety net for public health and medical services for people who are underinsured and don't have insurance at all. When we tell now an entire population to stay away from the emergency room unless you're sick, and those individuals do not have medical homes, where do we tell them to go? And as we see the ramping up of over $1 trillion, we heard this morning, of resources to stimulate the economy, pay for labs, equipment, airlines who are losing money, but there's not a pathway to take care of those who are homeless and don't have access to quality and equitable care. What are we doing? Telehealth companies are out there and they're a great service, but we don't have a pathway to get those telehealth services to those who don't have insurance. And so Shared Harvest Fund has launched myCovid, I think there's feedback, myCovidMD that will launch by the end of this week. And what it is basically we're building a community health partners task force. And anyone who has any background in healthcare and is sitting at home and saying, gosh, I want to do something, I want to be a part of something that's actually positive, you can register to be a video community health partner. And you can reach out and touch your neighbor by giving them factual information and helping them disseminate the information that they're getting from the media and other sources. But you're also able to help us and our telehealth partners screen and provide appropriate treatment where necessary. And this is a free service that we want to make sure anyone can have access to. So.
That's amazing. I love that. I'm so excited. And like what my𝗖𝗢𝗙𝗗𝗓 just said is exactly, marginalized communities are ostracized from quality medical care. And this is such a great resource to have. So we'll make sure that you guys have a link, or you can go to Shared Harvest. I imagine you guys will have that on Shared Harvest Fund,
yes, we'll
Instagram, and your website. Do you have the login now?
Well, the website, if you go to the landing page, you can actually register. It's myCovidMD.org. And by the end of this week, you'll be able to start seeing information about how to set that up. And one of our first telehealth partners is my𝗖𝗢𝗙𝗓, which is Dr. Richard Watson, who's been a frontline ER doctor
and is waiting right
Chicago.
now. Yeah,
and so, it's amazing, and we'll tell you all about it.
Great. So, Nana, do you have our login now? Because I'm going to sign off. We're going to jump back on. I just want to make sure you have it.
Yeah, I have it. So I just have to sign in as the user and the password and come back in? Okay.
Yes. So you'll come back in and then you can join him. I am going to sign off, but I want to thank you. I am so honored to have you as a member, to have Shared Harvest and NanaEfua be part of our resources and our network. It means so much. And at this time, we're all feeling a lot of anxiety, and I'm trying to stay calm through it, but we want to really protect our community and protect our globe. This is an opportunity to see how connected we are. And as we're social distancing, it's very, it's hard, especially for a community like ours, which is about being together. So having you here and offering this service is amazing. Appreciate it. I'm going to sign us off, but we're going to sign right back on with the esteemed NanaEfua and her colleague, Dr. Watson. So we'll see you shortly. Please sign on to the new Insta Live. And I appreciate everyone here. Everyone stay safe, be well, and follow the simple rules. Like she said, this is not a time to panic. It's a time to be prepared.
Exactly.
All right. Talk to you soon.
So eloquently said. right, I think we're here. Hi.
Hey, Don, let me adjust my.
So, Bridget, I think we got it.
Do we have it?
Yes. So, allow me to introduce the amazing Dr. Watson and the incredible work you do. Can you want to tell our audience about you and Emerge?
Sure. Just before we started, I had to take some paracetamol because they want to use any acidity. Nana, thanks for the invitation. Great conversation. A lot of great information. I hope some people really benefited from it.
Mm-hmm.
So just a little background. I also am an emergency physician. I am from New York, but trained in Chicago at the University of Chicago. Was a former chief resident there.
Woo!
Yeah, I think I was actually the first Black president in the University of Chicago.
Yes.
Went on to become a medical director, chief of emergency medicine for about 13 to 15 years. Formed my own group, Emerge Med Staffing. From that, we created a division called Emerge Telemedicine, in which we used latest technology and platforms to provide medical consults and care to those who, for whatever reason, can't make it to the hospital, be it convenience, inability, what have you. We have a service so that they can connect with physicians to seek care, which has been a big deal in the flu season, but in particular, now that we have COVID on the loose, it's really going to be the modality of choice for patients seeking out help, particularly those with lower yield symptoms. So I'm happy to be here to talk about telemedicine, the use of telemedicine, and why I think it is the modem that we need to use at this point.
Great, and you're absolutely right on point about that, and ahead of the curve by embarking on that technology. Right now, especially in Black and Brown communities, tech has become the great equalizer and new advancement for equity. And seeing how health tech can be leveraged to also provide healthcare equity is very important. Can you, I think I see some of the questions here. And one of the questions that Mutual Carbonation has is how mobile IS, our federal response to national pandemics. Do we have trucks that get on the road into communities with tests, supplies, information? Is this something under CDC, military, DWB? Well, it's kind of about mobile, it's kind of IT. I can tell you the FEMA and National Disaster Services are involved in the movement of tests, supplies, and everything to various jurisdictions and locations. People remember how the FEMA response was during Katrina. It was slow, but they learned from the lessons. And since then, FEMA has been much more efficient about getting things to places and to locales. But this is uniquely different, right, Dr. Watson?
This is different because we're talking about nationally, right? We're talking about getting resources to 50 states and territories as well.
Mm-hmm.
I've done a conference, radio morning show talk with Ed Lover from Ed Lover Morning Show, and he asked me about the limitation of testing and was concerned about why certain people were getting tested and other people were not getting tested.
Mm-hmm.
And what I explained to him was, when this thing hit in, I think December 19th was the first time where China, Wuhan, actually acknowledged that there was a problem.
Mm-hmm.
And they put the world on alert. And many places sat back and said, well, let's see if it's just going to be an epidemic, right? Localized to a particular area, spread of disease localized to a particular area, versus a pandemic. And I think when it first hit the states in January, by late January, there was still not a response by the CDC. By that time, neighbors such as Korea and some other countries had already heeded the warning and started to produce tests. So when we see South Korea, administering 12,000 tests a day, it's because South Korea jumped on the ball right away. I don't think, and I'm not, I don't know what goes on in the interiors of the CDC. I know the CDC has had challenges with fundings under the current administration. And I don't know if that's related to why they were so behind, let's be honest about it, in the testing, but the fact of the matter is they were behind in testing. So now we have this issue where we need to distribute testing and the resources that physicians like you and I need, and we're behind in that. So we have to make do with what we have at this point. And what we have is clinical knowledge. We have technology, which is where telemedicine comes in. And, we as the physicians now, it's our charge and our responsibility to try to get to as many people as possible, to not just, administer medical treatment, but to give out facts, not fiction, to quell anxieties and certain panics that, I understand people's angst. When you hear COVID-19 every 30 seconds on the television and, beware and what have you, that really, elicits a response in people, particularly if it's over and over again.
Yeah.
I wish they would have given this much effort to influenza as we are 18,000 deaths for influenza.
Exactly.
18,000 deaths in 3 months.
Yes.
Problem.
Yes.
But, here we are with COVID. I will tell you, whatever comes out of this, people will be certain to be mindful of their hygiene again.
Yeah, absolutely. Yeah. And just to piggyback on what you were saying, I remember my mom used to always say, and I'm sure this goes out around, when America catches a cold, Black people catch pneumonia, and people of color and disenfranchised communities suffer in a deep way when we're not prepared. Mm-hmm. So imagine when we are behind the 8 ball. Yeah. I recently learned that the National Guard is going to be dispatched. Mm-hmm. And imagine already we're in a very tenuous situation with healthcare and the government being trusted in communities of color. Now imagine the military being deployed during a public health crisis.
Correct.
It's not the smartest strategy, and more that we can rely on communities who have health providers who are culturally competent, who know, and communities who have teachers and social workers who can take care of each other and be neighborly and give the information through that source. That's where the resource pipeline needs to ramp up and to support individuals on the ground doing the work on the ground, rather than bringing an army force to address something that's only going to heighten the level of anxiety because we're just not prepared.
Yes. Yes. And let me deal with 2 parts of that, because I did see a question about anxiety and on the immune system. First, again, we as physicians want to combat the anxiety with information and facts. If you are concerned about COVID-19, your exposure, our recommendation is not to go to the emergency department, not to go to urgent care, not even go to your doctor's office. We've set up through our website, www.emergetm, that's EMERGETM.com. It's our telemedicine website. If you go on that website, sign up. We are giving people COVID-19 screenings. We have eliminated the need for insurance during this time. We have dropped the cost of a visit. I think we're making it $20 just to cover the basic costs of maintaining, the platform. But the reason why we're doing it is because we want to deal with people's anxieties, and we want to make it affordable so that people in underserved communities can afford it. I was on an NAACP call Sunday night, National Call Sunday Night, and we addressed the fact that, amazingly during these times, when, all Americans sort of band together, there is still certain segments of the population, that banding together.
Banding together.
Yeah. But, we want to make it known that, we have the resources. We, you or I, our physicians, we are here on the front line.
Yes.
We have resources. We are making the time to deal with, dispersing that information, screening patients, and treating them if needed through the telemedicine system. So, again, that is out there. This is a platform that we own. It's not, we own.
Yes.
We want.
We own.
Price $20. We've made the price.
Yes, exactly.
So we don't have to deal with any, outside forces telling us what we have to do. We are full of that, and we are able to disperse the information and the screening needed. You just have to come and get it. Now, I want to address the question that was up, as I saw before. What effect does stress have on the immune system? A lot. Exactly. If you are stressed and fatigued, there's reactions in the body that occur. And just to keep it very simple, stress and fatigue suppress the immune system. Yep. Now, I talked earlier, and I'm glad you addressed not just prevention, but not just hand cleaning and staying away from the virus, but also importantly, if your immune system is good and you are doing the appropriate things, which again she mentioned, hydration, critically important, getting enough rest, also critically important. It allows your immune system to regenerate itself, and getting some exercise. Those catecholamines boost your immune system. If you are stressed, you are suppressing many of those systems, and thus you will allow for a decreased immune system and more susceptibility to COVID, influenza, rhinovirus, adenovirus, etc. So, dealing with your stress is really, really important. And we realize that many of the people who will seek us on the telemedicine site will be dealing or will be requesting some form of possible therapy and counseling. And so we also have that set up for them as well.
Awesome. And that is actually exactly why Shared Harvest is partnering with my𝗖𝗢𝗙𝗓𝗓M, because we trust wholeheartedly the heart, the intention, and the clinical skills that is coming through this particular telemedicine site. And we know $20 is nothing when you're talking about a real health provider who knows what they're talking about on this issue. But we also know some of our communities can't even afford $20 and at least can't do the screening. And so that's where the Shared Harvest, myCovidMD initiative, and our Community Health Partners initiative is coming in to supplement that. So we are raising funds so that we can offer this service for free and still support E.M, my𝗖𝗢𝗓𝗓𝗓M, so they're around after this event, this crisis is over, to continue to offer the great services. And I've often said the technology out there, esports is making billions of dollars. All they can in our communities, we are asking esports like Play Versus to supplement the Shared Harvest myCovidMD initiative, so that we can provide this free service for people and to fund in this way, because we can take care of our own communities. If you're right, we have all the intelligence and technology and the decades of medical experience to take care of our community.
Right.
Yeah, you were going to say something.
I was going to say, don't say decades. Don't age us out.
I said collective decades.
the fact
Seasoned.
The fact of the matter is, at this point, it is
seasoned.
So, yes. But yes, and that's, I want to commend you and Shared Harvest in putting that together, because it is crucial, right? We need to be able to service communities and those who don't have. We still have, I think 14 million uninsured in the nation, right?
Exactly.
So although yesterday's conference on the COVID updates said that all in testing would be paid for by insurances, and that even the copays would be even the copays would be forgiven at this point. That's fantastic. There's still 14 million people who don't have Medicare, Medicaid, or in private insurance.
Exactly.
That left behind, and all too often, we know what those particular folks look like. So
yes,
we need to be inclusive, and if you have insurance, great. You have Medicare, Medicaid, fantastic. If you don't have insurance, no problem. That's what we in these right now. So.
And I think one of the things that as our communities need to understand, as our country needs to understand, is that healthcare is still not a human right in the United States of America. So just because we're in an emergency doesn't mean all of a sudden it does. What we do is a lot of reactionary plannings and programs around, okay, now this is a crisis, what are we going to do about it? And as a result of that, if we're always running after a crisis, we're never going to understand the ways to pave an underlying solution to resolve the matters that are dealing our communities at large. And so everyone who has resources will get the resources, and those who don't have the resources will be left behind. And we see this time and time again. So we don't have to repeat the wheel. We can learn from history. We don't have to say all the things that happened wrong. Is this going to happen again? We, fold our hands. We can look forward, and goes to the last part of this segment that talks about what can we learn from COVID-19 and what kind of systems can we put in place so that when this happens again, because it will, what do we have already in place? And one of the things that Shared Harvest has been trying to do and push for is that Community Health Partners Strategic Task Force, which are community members, which we have already done when time is of need. We activate the best among us to teach, to reassure, and to provide treatment. And one of the things I didn't mention was Shared Harvest is focused on getting all those people out of debt in terms of student loan debt. So if you are a healthcare worker and you're doing this and you're out there and you want to make a difference and you happen to have some student loan debt, join the CHP program. And our intentions is that every time you do and serve in this capacity, that you get your student loans reduced as well. So we're hitting it both ends.
Great work. That's great work.
Yeah.
So I saw a question about medical redlining, which I think is a very interesting question.
Yeah. Yes.
Once we have passed through this pandemic, and we will pass through this pandemic, many of these viruses are seasonal. We know that the flu virus is seasonal. But I think the paradigm will be changed after this particular pandemic in terms of how people will go about seeking medical treatment. And, telemedicine is not a new thing. It's been around for some time. I think it's becoming more crucial at this point because of the high rate of transmission of influenza and COVID. And it is the safest way for patients to be screened right now. So it's gaining its popularity. But I think once it's done, I think we'll be able to incorporate telehealth into areas where there are limited medical resources. Obviously, this telehealth has its limitations, but it can reach, as long as you have Wi-Fi, a cell phone at this point with 4G on it. Telehealth will be available for people who have limited access to healthcare. So I think that was a great question, and hopefully, again, once we pass through this pandemic, we will see a change in the way medical care is distributed.
Yeah. And speaking to that too, it starts to beg the question, should internet be a utility? and a free service and access to everyone. Because like you said, if you don't have 4G, you don't have access to Wi-Fi, but telehealth is available. What about those communities that don't have access to basic Wi-Fi? We still have communities down south who aren't connected very well. Those are, again, as we forge beyond this critical period to start thinking about how to have systems in place to make it equitable. Those are the discussions that need to be had.
Yeah, absolutely.
Yeah. There was any other questions? There's a question, how do you get information? So I believe Bridget and her team we can drop the websites, the contact information in the comments or in the reminder. But the Shared Harvest is a nonprofit foundation. The free telehealth services is going to be on myCovidMD app that is going to drop. It hasn't dropped yet, but the website is available. my𝗖𝗢𝗓𝗓TM is available now. They have been operating for years, so this is not something new for them. What they are doing is ramping up their initiative to offer this service for our community.
Yes. Any other questions that we can answer about telemedicine or COVID? I think you did a great job in the first half, just debunking a bunch of myths. A couple others that I've heard, Black people won't get it, can't get it. That is absolutely not true. It is a virus. It has no sense of discrimination whatsoever. I will say I did a conference, a webinar actually, on with some college students for those who are of that age group or those who have children of that age group who are at school. One of the big questions was, should I stay at school or should I come home? And my answer to them was, if you are going home to grandparents or parents who are ill, who have multiple medical problems, understand that you going home is going to possibly increase their risk of exposure. And those are the folks who we know aren't doing well with this virus. So if you have an option to stay at school, and you have that environment home, then you should probably stay at school. Them understanding, and people in general understanding, who's most at risk for this, for the downwards symptoms, the pneumonias and SARS with this particular virus is key. We have to protect our elderly at this, and our sick at this point, because those folks have to unfortunately have had the worst outcomes with this.
And I think one thing we can also just kind of touch on, and we're talking about the healthy people who are not going to emergency department, right? But what about when you have to go to emergency department? Maybe we can speak a little bit about what should you expect when you're going to the emergency department, and how do you make yourself safe when you have to go to the hospital?
I'll tell you what we've been doing here in Chicago on a local level. We encourage folks who are concerned or have symptoms to first check in with their doctors via telephone or obviously via telemedicine. That's the first thing. We don't want you going to the hospital where people are sick to check to see if you have the virus, because you may be asymptomatic or have low symptoms, but the person you may be sitting next to when you get to the emergency department may be, have multiple medical problems, and we don't want you, your low symptoms or asymptomatic symptoms, transmitting that virus to a person who's going to have a worse outcome than you. So that's the first thing. Get in contact with your doctor via telephone, via telemedicine, or seek out a telemedicine consult from me. It doesn't have to be emerge telemedicine, but seek out somebody. Number two, once you've been screened by a physician and that physician says, you know what, you hit the key factors that you need to be evaluated. Again, let's recap that. That's fever, cough, and short breath. Doesn't mean you have COVID. You could have pneumonia, you could have the influenza, you could have, bronchitis of some other source. But we know that those people are having, those with COVID have at least those three symptoms. If you do qualify that, your doctor is going to give you instructions on where to go. Some hospitals have a COVID screening center. I know we are setting up a outdoor screening center in one of our institutions where those who are referred by the physicians to get tested will come through and they will be dealt with away from the rest of the population. And if they need to be admitted, they'll have routes for them to go through for that. But again, we still want to try to practice medical isolation in these times, and that begins with the
self-distancing isolation.
Correct.
Yeah. I can speak from southern, not so sunny Los Angeles, and what many of the larger hospital facilities have already started what we call drive-through testing. And drive-through testing is for if you end up going to the emergency department, if you present with any of those first symptoms, you're automatically given a mask. And then you are either asked to stay in your car, and a nursing team that has full PPE garb will come to your car, ask you a series of questions, and swab you for influenza, other viruses, and the medical officer, ER physician, will then ask you questions to see if you qualify to be swabbed for COVID. But most of the treatment you get stays in your car, unless they feel that you're having symptoms that need to be addressed, and in which case you will be then transported into the emergency room, where several emergency departments have designated rooms that have certain plastic material and coverings, and ventilations are set up to protect the staff that are working there and the patients who have to come in. So it's a very different space than you typically would see in an emergency department or clinical office. And that is why the concern of too many people going at once is of high alert, because those rooms have to stay isolated, set up in an isolated way and sterile way.
Correct.
Yeah. So, any last burning questions from anyone?
Or for the folks and the good people, and just if anybody's coming on late, just let them know, some of the core things, some of the basic things, and I'll let you.
My last recap, my take home is always the COVID kiss, which is keep calm and wash your hands. If you're sick, self-distance, show compassion and kindness, and share facts, not fiction. And if you go with that, I think you've got your 99% there, and we will all get through this together. This too shall pass.
Excellent.
Yeah.
If my recap is, if you have concerns, get the facts, contact your physician, call your doctor. If you don't have a doctor, you can contact us, www.emergetm.com. We will be happy to screen and answer questions. You don't have to use this. You can use whatever resources you have, but get facts first. Get information before you make a move that may be detrimental to you or to someone else.
Exactly.
Yep. All right, Nana.
Us here to invade her Instagram live channel. And you can always follow Shared Harvest Fund at our Instagram at Shared Harvest Fund. And we're always dropping information about how to serve the community best as well. And we wish you guys all love, protection, kindness, and safety. All right. Thank you guys. And have a good day. Take care.
Take care.